Dear colleagues, I want to present you today interesting case. This patient was referred to me because of this sinus structure palatal side. Percussion was sensitive, palpation was sensitive. Now the pockets, you can see radiolucency in lateral area, also in apical area a little bit, and some strange form of the roots. And not so good crown. We see here a leakage and maybe secondary caries. And in a differential diagnosis, I put chronic apical abscess, of course, and also suspected vertical root fracture. From this reason, I referred patient to CBCT scan. And on CBCT scan, you can see that we have a big hypodense area around palatal root. In part of the root, it's an apical part, and also in lateral part. Also, we can see a reaction in the sinus, some widening of the oral mucosa. Also, we can see a lesion on mesobuccal root, and we can see perforation of palatal cortical plate that explain us why we have sinus tract in this case from the palate. Also with the MB2 that wasn't treated before, and with the interesting anatomical feature of this specific tooth, the fused palatal and distal buccal root. And between them, we see what I thought in the beginning was a isthmus. Okay, final diagnosis was chronic apical abscess, and of course I explained everything to the patient, and I started my retreatment. I found MB2, as you see. It was not so easy to go through the old material or in MB1 canal, and in many cases during the treatment I do additional X-ray to check the level of cleanness in the root canal system, and you can see that I need to continue to work and to clean this old filling material, because beneath we can have a biofilm that will be very difficult for us to destroy by our irrigation because of this sealer and maybe gutta-percha inside. Again, during my work in the beginning, I think that in these fused roots, I have an isthmus between palatal and distal buccal root, but if you can see some white spot here, it was some suspicious for me. Maybe we have here additional canal, and during my work, I found distal buccal second canal, DB2, and of course I instrumented it with my night eye instrument. After, in the end of the first visit, I put titanium hydroxide, and 1 month later, no sinus tract. Okay, sinus tract disappeared, and the second visit was for obturation. Very nice one. All 5 canals were obturated. I tried to check my obturation with different angles. Finally, to see all 5 canal was obturated. And some days ago, I had a 18 months follow-up, negative percussion, negative palpation, no pockets, no sinus tracts, and a very nice healed lateral and apical lesion. Thank you for your attention. Maybe this case was interesting for you.